Today we are going to be talking about fibroids. Fibroids are growth made of muscle and tissue that occur around the woman's uterus. And doctors don't know the exact cause of fibroids, but there are a few factors that may contribute to it. The first is hormones. Hormones that control the menstrual cycle actually support fibroids to grow. And these hormones are higher when a woman can have babies and lower after menopause. The second is genetics. So if your mother or sister has fibroids, the chances are that you are more likely to also have fibroids. The third is growth factor. Growth factors are substances in the body that help support tissue growth, and they may contribute to fibroid as well. Other factors like African women have the higher tendency, people with obesity also have higher tendency, and then people that start their menstrual cycle at a younger age also stand a chance of having fibroids. So here are some of the symptoms of fibroids and the science behind the symptoms. The first is heavy periods. Fibroids can affect the way the uterus contracts during your period. This can lead to an interference with the process and hence heavy bleeding. The second is pelvic pain and pressure. The uterus is like a balloon, so when fibroid grows, it stretches this uterus and puts pressure on the organs around it, organs like the bladder and the intestines. This causes a feeling of fullness, heaviness, and pain, especially if the fibroid is very big. The third is frequent urination. When the fibroid pushes the bladder, it reduces the space for urine to fill in. So even if there's very little urine in the bladder, because the space has been reduced, you will always feel like you need to urinate. The fourth is back or leg pain. When fibroid grows at the back of the uterus, it affects the nerves that connect to the back and the leg, hence feeling of that pain. The fifth is bloating and swelling. Fibroids make the uterus grow larger, sometimes to the size of a pregnancy. This might make your belly feel bloated, as if you are gaining weight. The sixth is pain during sex. Depending on the location, fibroid can cause pain in the pelvic area. This can make sex painful and uncomfortable, especially if the fibroid is close to the cervix. The seventh is fertility issues. If fibroid grows inside the uterine cavity, it might block the pathway for sperm to meet with the egg and interfere with implantation. This makes it harder for some women to get pregnant. So what can we do naturally to prevent or to reduce fibroid? The first is eating a healthy and balanced diet. There must be an increase in fruits and vegetables, increase in fiber-rich food, and also we must make sure that the diet has healthy fats. The second is to maintain a healthy weight. Just make sure that your BMI is within range. The third is to limit red meat and processed food. The fourth is for you to manage stress. And the fifth is for you to balance your hormones. Sixth is regular exercise. 7 is staying hydrated always. 8 is to avoid environmental toxins. The 9th is to make sure that you have enough vitamin D. 10 is to make sure that you infuse herbal remedies in your diet. Herbal remedies like Friska tea for women that helps you balance your hormones naturally. And because it's rich in antioxidants and natural zinc, it helps work against inflammation and tumors. You can find Friska tea for women and other Friska herbal teas in retail supermarkets and pharmacies nationwide. Or you can place an order on our website or send us a DM on our social media handles. If you enjoyed this video, please like, share, and subscribe to our YouTube channel. Until we meet in the next one, start your journey to a healthy life with Friska Herbal Tea.